There is more evidence that Americans strongly support vaccines despite Health Secretary Robert F. Kennedy Jr.'s attacks, which many health professionals say is perpetuating a health crisis in this country. The NBC News Decision Desk poll released just moments ago found that an overwhelming majority, 78% of Americans and 67% of Republicans support using vaccines for the prevention of diseases. Breaking it down by party, 93% of Democrats say they support vaccines, as well. That's 72% of independents. Ahead of Kennedy's hearing on Thursday, several Republican lawmakers saw a similar poll, which found that a majority of President Trump's voters believe vaccines save lives. That helps explain the tough tone that some GOP senators took with Kennedy during that hearing, including Senator and physician Bill Cassidy.
Mr. Secretary, do you agree with me that the president deserves a Nobel Prize for Operation Warp Speed?
Yeah, absolutely, Senator. That was phenomenal.
Let me ask you, but you just told Senator Bennett that the COVID vaccine killed more people than COVID.
Wait,
that was a statement.
I did not say that.
Okay, then let me ask, because you also
Senator, I just want to make clear, I did not say that.
We'll check the record. That's a question of fact. You also said that you were also, as lead attorney for the Children's Health Defense, you engaged in multiple lawsuits attempting to restrict access to the COVID vaccine. Again, it surprises me that you think so highly of Operation Warp Speed when, as an attorney, you attempted to restrict access.
Joining us now, Dr. Jerome Adams, who served as Surgeon General of the United States during the first Trump administration. Doctor, thank you so much for joining us. You heard the numbers. 78% of Americans approve of vaccines for prevention of disease, 67% of Republicans. The health secretary, not so much sometimes. You were in meetings with President Trump during that first term. Where is President Trump on vaccines? Because sometimes it's a little unclear.
Well, I'm so glad you mentioned those polls, because this is often framed as a partisan issue. And yes, we do see some partisan differences, but the lion's share of Republicans, including based on my experience with him, President Trump, support vaccines. And I'm deeply alarmed by the objective danger that RFK, not Republicans, but singularly RFK, poses to the nation's health in his current role as HHS secretary. Under his leadership, we're seeing a rollback of vaccine access, a breakdown in public trust, and we're seeing policies that are putting particularly vulnerable communities at risk. This isn't theoretical. It's happening right now, and real people are being hurt by his leadership.
Dr. Adams, thanks so much for joining us. I'm really curious if, obviously the Office of the Surgeon General falls under the purview of HHS, under RFK. If you were Trump's Surgeon General in this very moment right now, in this second administration, would you continue to feel comfortable working for RFK Jr.?
Well, as far as RFK Jr., again, he is singularly making decisions that I believe are bad for the nation's health. His tenure has been marked by a stunning collapse in leadership and credibility. You see ACOG and AAP, obstetricians and pediatricians saying we can no longer trust him. He misled Congress. We heard Senator Cassidy talking about this, about ensuring vaccine access. Under his watch, public trust in vaccines has fallen to historic lows. And let's be clear, he's actively undermining the president's agenda and eroding one of President Trump's greatest public health achievements, Operation Warp Speed. These aren't just one-offs. It's a consistent and dangerous pattern of leadership failure under RFK.
Have you communicated that to any of your old colleagues who are still in the Trump administration?
I talk to people in the Trump administration. We talk to other public health advocates all the time. And that's part of the reason I'm here talking to you all. I don't have direct access to the president or to Congress anymore. But one of the things I did do, you'll see in my USA Today op-ed, along with other former surgeons generals that came out on Friday, called upon the American people to express their concerns to Congress, because they're the ones who, again, have the power to actually change our trajectory that we're going on. And right now, that trajectory is one towards poor health, towards more people dying of vaccine-preventable diseases.
Dr. Adams, you mentioned that, it wasn't a partisan issue, vaccines. But Republicans have there is much a stronger subset of Republicans and on the right who do believe and share vaccine misinformation, right? Robert F. Kennedy's not just talking to himself. The Florida Surgeon General said something over and did something last week that I want to get your response to.
Who am I as a government or anyone else, or who am I as a man standing here now to tell you what you should put in your body? Who am I to tell you what your child should put in your body? I don't have that right.
That was during an announcement that Florida is going to eliminate all vaccine mandates. When you see Florida being the first state to do this, we all know how it works. It just takes one and then other states will start doing it as well. What are your concerns about red states that are going this way possibly?
Well, I live in a red state. I live in Indiana, and this breaks my heart. It truly breaks my heart. And the fact that it's happening in Florida, this is the land of senior citizens and kids from around the world at amusement parks, the people who are most vulnerable to vaccine-preventable diseases. This is not going to play out well. Let me be clear to you as a public health advocate, as a physician, this is going to go poorly. And it's not his health secretary who's going to own it. Ron DeSantis is going to own this. He's going to be remembered as the governor who got rid of vaccine mandates in Florida, in a state where, again, you've got many seniors who are at risk. And so this signals a troubling shift towards anti-science policymaking under the watch of RFK. I know that we have these debates about, again, partisanship, but this has uniquely happened under RFK's watch. This didn't happen under the first Trump administration. It's happening now. And it's why I think RFK's leadership is uniquely dangerous, and why people like Ron DeSantis, people like President Trump would do well to be very cautious about what they're listening to and the advice that they're taking from people like RFK.
Doctor, you said that it would go poorly in Florida, this end of vaccine mandates. What do you mean by go poorly? I'd love for you to be more specific.
Well, more specific, we've seen the largest measles outbreak in 3 decades happen this year. 2 children died. And strangely, RFK called that a success recently. That we have over 100 people who've been hospitalized and 2 died. Wisconsin, a measles outbreak going on right now with 24 people, kids missing their first week of school because of measles. And this is going to disproportionately impact vulnerable communities of color. I'm very worried about our COVID season this year. Nearly 50,000 Americans died from COVID last year, more than car crashes or breast cancer. And we know that communities of color face a heavier burden of disease, despite what RFK says. Hypertension or high blood pressure, 57% of Black adults versus 43% of white adults. Obesity, 50% in Blacks versus 45% in Hispanics, and lower numbers in whites. So the people who are most vulnerable are going to be the people who are going to suffer in Florida and Texas and all over the United States if we continue down this pathway.
And Doctor, I just want to be crystal clear here. So is what you're saying that we should all expect an uptick in certain diseases such as measles?
Absolutely. We are seeing it. We're going to lose our measles eradication status as a country. I'm worried we're going to see diseases like polio come back. You had 2 people die of whooping cough in Louisiana this year. We don't need ideology and politics right now. We need competence, clarity, and compassion. And we're not getting that from the top of HHS at the moment.